Dear colleagues, dear students, we continue the lecture series from the University of Pécs, Hungary. Today's topic are alcohol-related problems. I would like to give a short summary on this. Let's see a few epidemiological data. If we have a look at the population, about 90% of the population ever had a drink. The current drinkers are among 60 to 70%. There are around 40% of the population who has temporary problems with alcohol. Alcohol abuse among the males, 10%, and 5% of the population are who has abuse problems. And dependence, you can see the rates, 10% in the population and 3 to 5% in the males and 3 to 5% among the females. And you can see a note here that 20% to 30%, 20% to 30% of psychiatric patients has problems with alcohol abuse and alcohol dependence. There are some epidemiological data, mainly from American textbooks, which I very shortly would like to show here. Whites have the highest rates of alcohol use. Hispanics and blacks have a similar rate of binge use, but the rate is lower among blacks than among whites. In the terms of gender, men are much more likely than women to be binge drinkers and heavy drinkers. This is what we know. If we compare region and urbanicity in the case of alcohol-related problems, we can say that alcohol use is highest in the western states and the lowest in the southern states. North, central, and northeast regions are about the same, so these are the data from the United States. And the rate of past months alcohol use was 56% in large metropolitan areas, 52% in small metropolitan areas, and 46% in non-metropolitan areas. So urbanicity means a higher risk for alcoholism. Education also, there are some epidemiological differences. What we see here, that's 70% of adults with college degrees are current drinkers, compared with only 40% of those who has less than high school education. And binge alcohol use nearly shows the same educational background. Socioeconomic class as an influential phenomenon on alcohol use. Alcohol-related disorders appear among persons of all socioeconomic classes, and this is what we have to know here. Which are the signs of alcohol intoxication? Slurred speech, dizziness, incoordination, ataxia, unsteady gait, nystagmus, impairment in attention and memory, in more serious cases, stupor or coma, and double vision can appear. And you can see compared to the level of the alcohol in the blood, the different levels, different degrees, the different seriousness of the symptomatology, that the alcohol level, how is in correlation with the symptomatology. Okay, mainly for the treatment of drug treatment of alcohol withdrawal, and this is what I would like to emphasize here. For alcohol withdrawal symptoms, typically in outpatient services, benzodiazepines should be used. The dosages are not important for you. For the treatment of alcohol withdrawal, vegetative signs as sweating, as tremor, as tachycardia, as elevated blood pressure, benzodiazepines are the first choice, and later thioprid or carbamazepine can be used. Which are the neurological and medical complications of alcohol use? We have already touched alcohol intoxication. We had seen the signs of alcohol intoxication in the previous slide. There is a much less frequent illness which is called pathological intoxication, or atypical, or complicated, or unusual, or idiosyncratic alcohol intoxication, where the symptoms are small appears after taking of a small amount of alcohol. Ego alien aggressive behavior can appear with amnesia and terminal sleep. Blackouts are serious amnesias after serious alcohol intoxications. The alcohol withdrawal symptomatology are tremor, which can happen, tachycardia, sweating. There is another illness which can be connected to alcohol withdrawal, but also to heavy alcohol abuse and heavy drink, is alcoholic hallucinosis. In the case of alcoholic hallucinosis, there are no real withdrawal symptoms. The sensorium, the consciousness is clear, the patient is oriented in time and place, but horroristic acoustic hallucinations and serious anxiety appears, and this is the syndrome, this is the illness which is called alcoholic hallucinosis. In withdrawal states, in alcohol withdrawal delirium, many times about 30% of all patients with alcohol withdrawal delirium, we see convulsions, withdrawal convulsions, seizures. There are some other alcohol-related mental problems which are mainly caused by nutritional diseases of the nervous system. The Wernicke-Korsakoff syndrome, the Korsakoff syndrome, which is a triad, short-term memory loss, disorientation, and confabulation. And in the case of Wernicke encephalopathy, what we see is encephalopathy, ataxia, nystagmus, and serious neurological symptoms. Cerebral degeneration can appear. Peripheral neuropathy typically appears in many cases with alcohol dependency, optic neuropathy, and pellagra. There are some rare diseases which you have learned from pathology, as the central pontimyelonisis, the Marcia-Falva-Bignami disease, which is connected to the atrophy of the corpus callosum, fetal alcohol syndrome in the case of pregnant women who are alcoholics, and serious mental retardation with different minor physical appear in the newborn, which is called the fetal alcohol syndrome. Myopathy, dementia, cerebral atrophy can appear. We know from pathology and from internal medicine studies that liver is seriously disturbed by alcohol usage, and some illnesses as hepatic encephalopathy or chronic hepatocerebral degeneration, acquired form, non-Wilsonian form can appear. Gastrointestinal diseases, ulcus, malabsorption syndromes, and pancreatitis can appear in the case of alcoholic patient. Cardiovascular complications, hypertension, ischemic heart disease, hematological disorders in some cases, anemia, leukopenia, thrombocytopenia can appear in cases with cirrhosis. Some infectious disorders, hypothermia, hyperthermia, hypertension, respiratory depression, and associated hypoxia in the case of serious alcohol intoxications can be mentioned, electrolyte disturbances. So many somatic complications of alcohol usage, serious alcohol dependency, or serious alcohol intoxications can be mentioned from the somatic perspective. Also, you can see traumatic brain injury complications, which this slide summarizes. And with this, I would like to thank your attention for this short lecture. But before I finish, I would like to summarize very shortly the treatment issues, which are not summarized in this slide list. In the treatment, it's very important that first the somatic treatment of the alcohol withdrawal is very important, as I've already mentioned, where benzodiazepines, thioprid, carbamazepine, and haloperidol, vitamin B, magnesium can be given. For some alcohol-related psychotic problems, as alcoholic hallucinosis, which I mentioned, that beside conscious sensorium and orientation, there are serious acoustic hallucinations. Here, the choice is haloperidol for the treatment. There is a psychotic illness which is called alcoholic delusional disorder or alcoholic paranoia. The most important symptom here is delusion of jealousy. And in this case, also antipsychotics as risperidone or haloperidol or other antipsychotics can be given. For a long-term treatment of alcohol use disorder or alcohol dependency, very important, the psychotherapeutic approach, very important to increase the awareness of the patient on his problem of alcohol dependency. And here, psychotherapy, motivational interviewing as a special form of psychotherapy for addictions is essentially important. The most important method in motivational interviewing is developing a discrepancy between the patient's maladaptive addictive behavior and the patient positive and still remaining positive goals that the patient would like to continue working. The patient does not want to lose his wife, does not want to lose his family, and the discrepancy between the maladaptive addictive behavior and the positive goals can be emphasized during the dialogue with the patient, and it can be used as a motivation for change. Sociotherapeutic methods as occupational therapy, rehabilitation centers which offer long-term occupational therapy forms, long-term rehabilitation approaches are also important. Very important to mention are the self-help groups, the Alcoholics Anonymous movement, the AA movement, which was started in the US in the 1940s, where model effect, the model of sobriety, and the so-called 12 steps model of the Alcohol Anonymous groups are highly influential towards patients who would like to change their attitude and who would like to change their maladaptive way of life, which can be mentioned here. From a pharmacological perspective, two drugs can be mentioned, acamprosate and naltrexone, which can help to reduce craving, to reduce wish and desire towards alcohol, and these are the recent pharmacological approaches towards alcohol dependency. So with this short summary at the end, without slides, I would like to send your attention and emphasize the importance of your book chapters on alcohol dependency. Thank you very much for your attention.